Chapter 13. The Glucagon Injection. In this chapter, we will look at the Glucagon Emergency Kit, what it is and how to administer it. The idea of being injected or injecting your child with a glucagon injection is a terrible thought, but we recommend you pay close attention and prepare yourself mentally should the need arise for those around you or for you to inject your child using the Glucagon Emergency Kit. Firstly, you need to know when to inject and identify the signs of severe hypoglycemia. You need glucagon if your blood sugar level is less than 50.4 milligrams per deciliter, 2.7 millimoles per liter, and unable to eat or drink safely because they are confused or disoriented, unconscious, or having seizures. The first thing that the person treating you needs to do is to check your blood sugar level to make sure it's low. If he or she confirmed that you are experiencing a severe hypoglycemic event by checking the blood sugar, they must proceed administering glucagon from the Glucagon Emergency Kit. The total dose of glucagon is 1 milligram. If a child is less than 1 year old, he or she should receive 0.25 milligrams of glucagon. If the child is between 1 and 6 years and weighs below 55 pounds, 25 kilograms, they should receive 0.5 milligrams. If the child is 7 or older and weighs above 55 pounds, 25 kilograms, they should receive 1 milligram glucagon. With adults, the entire vial should be used. Always make sure to get the right dose information for yourself or child from your doctor or diabetes support team. There are various different glucagon emergency kits available. Have a discussion with your doctor or diabetes care team about your specific kit requirements and doses. If your child frequently visits or overnights at friends, family, or grandparents, they too should know how to identify the symptoms and administer the glucagon in case of emergency. The Glucagon Kit consists of a vial, syringe, and instructions. We highly recommend that you and those around you go through the instructions a few times beforehand. This will help you a lot in an emergency situation. The vial has dry glucagon powder and a syringe and is filled with liquid to dilute the glucagon. The syringe will already have a needle attached. There is also an expiration date in the glucagon. Always check this date before administering the glucagon. Write this date down in a calendar and make sure the glucagon on hand has not expired. How to give a glucagon injection. Open the Glucagon Kit. Flip off the cap of the vial containing the glucagon powder. Remove the cap covering the syringe needle. Insert the needle into the rubber stopper on the top of the vial. Push down on the syringe plunger to inject all of the fluid into the glucagon vial. Without removing the needle from the vial, gently shake or roll the vial to mix it. The easiest way to do this is to hold the vial and syringe in one hand, with the vial on top and the syringe on the bottom. Mix until all the powder is completely dissolved. The solution should be clear and colorless. Draw up the glucagon into the syringe. To do this, hold the vial and syringe so that the vial remains on top and the tip of the syringe is towards the bottom of the vial. Pull the plunger of the syringe back to draw the glucagon into the syringe. Be sure to draw the required amount. Injecting the glucagon into the thigh, buttock, or upper arm. Clean the injection site with an alcohol swab. Holding the syringe like a dart, insert the needle into the skin in one quick motion at a 90-degree angle. Use your thumb to push the plunger all the way down until all the medication is injected. When the syringe is empty, remove it slowly and at the same angle that you put it in. After injecting, turn the person on their side. They may vomit after the injection, and turning them on their side will keep them from choking. The person should regain consciousness within 15 minutes. It is recommended to immediately contact the doctor, diabetes team, or be taken to an emergency unit. Have a look at the resources posted at the end of this chapter for more information on the Glucagon Emergency Kit. In the next chapter, we will be looking at the diets and foods.